Good morning. With each passing day, more shots get into arms. With each passing day, we see a world beginning to look more like the one before the pandemic took hold. With spring officially 5 days away, hope is blooming, and I like that optimism is part of our conversation now. It was hard to see the good among the darkest days of the pandemic. Any talk of better days ahead, however, is blunted by the reminder that a deadly virus is still present and continuing to take lives and livelihoods. A fumbled vaccine rollout has added frustration to our progress. Conversations on vaccine equity should have happened before any distribution plan was executed. And seeing our residents drive several hours to snag an appointment or wait in hopes that there are surplus shots at the end of a vaccination event is no way to provide a service critical to ending the pandemic. It took a clarion call from urban areas like ours, public health leaders, community activists, the media, all in unison stating the obvious: get shots to where the need is the greatest. That is our commitment here in St. Louis County. Effective today, the state has added a tier of people who are eligible to receive the COVID-19 vaccine. Phase 1B, Tier 3 includes teachers and other school personnel, along with transportation and infrastructure workers. We expect this will add more than 100,000 eligible people in St. Louis County alone. While we may begin inviting some individuals in Tier 3 to make appointments for vaccine in the coming days, we must remember that many people in earlier tiers have been waiting a long time to get their chance. The health department will continue to prioritize the most vulnerable people in each tier for appointments. At the same time, we recognize our teachers and school employees need to get vaccinated so we can get our schools reopened safely. In-person learning is the ideal setting, and our children need to be in a place where they can socialize, develop interpersonal skills, and share life experiences with their friends. The St. Louis County Department of Public Health is working closely with school administrators to come up with vaccination solutions specifically for educators. We expect to have an announcement on that by next Monday. Remember, if you haven't been vaccinated, our best advice continues to be register with us at stlcorona.com, register with the state at covidvaccine.mo.gov, and register with our regional hospital networks. And check with your local pharmacies. As the county slowly reopens, the long-lasting impact on thousands of our residents remains. Housing insecurity has become all too common during this pandemic. More than $12 million from the CARES Act grant we received from the federal government last year went to helping our residents pay their rent and utilities so they would not face eviction or winter nights without heat. Evictions are on hold indefinitely in St. Louis County, but the inability to pay for rent and utilities is not. I'm pleased to announce that we are poised to distribute $29.7 million more for rental and utility assistance. That's how much St. Louis County received from the $25 billion Emergency Rental Assistance Program approved by Congress. We are currently in the final stages of partnering with a third-party administrator who will set up a call center to answer questions, screen applications, and ultimately get the money out the door. These are funds separate from CARES Act and separate from the $1.9 trillion relief bill signed last week by President Biden. Of that $1.9 trillion, St. Louis County expects to receive about $190 million. With those funds, we will continue focusing on the three areas we did with our CARES funds originally: saving lives, helping residents meet basic needs, and reviving the local economy. These are all essential to our community making a full recovery. You cannot have a healthy economy without healthy people, and we will continue working with our community partners to increase vaccine awareness and accessibility. We will continue working with our business sector advisory groups who have helped us with reopening guidelines for restaurants, gyms, and other businesses. And decisions on building a promising future are not done in a vacuum. It takes voices from all walks of life and all parts of our community to get us where we need to be. I'll be joining Congresswoman Bush and Mayor Crewson for a press briefing this afternoon to talk about the latest stimulus funds and the next steps. Please join us, and you can watch on my Facebook page beginning at 3 p.m. And as a final item today, we are relaxing our isolation and quarantine order to be consistent with the latest CDC guidance. Starting today, those who have been exposed to a person with COVID-19 need to quarantine themselves for 10 days, beginning with the day of first exposure. After 10 days, assuming no symptoms, they are free to end quarantine. Under the old order and CDC guidance, it was 14 days. Similarly, those who test positive for COVID-19 will need to isolate themselves for 10 days from the onset of symptoms. If patients have no fever for at least 24 hours and symptoms are improving, they can end isolation after 10 days. Until now, those who tested positive for COVID-19 would need to isolate themselves for as many as 14 days. We are relaxing these protocols to remain consistent with the latest CDC guidance. And I'd be happy to answer any questions.
Dr. Page, we have several questions this morning, starting with the $190 million we're expected to get out of the latest relief. Is that going to be handled similar to the CARES Act funds? Can the county executive spend the money without approving individual line items, or will the council have to ratify how the money is spent?
Okay. The question is about the process of appropriation and spending of the $190 million of CARES Act funds that are coming to St. Louis County. Last year, the council appropriated the funds to the areas of our community which had the greatest need. And that'll be the first decision before the council. Will these funds be appropriated based on need and areas of the county that have the greatest need? I would expect more detail in the appropriations as far as how much goes to humanitarian relief, such as food distribution and other assistance, how much goes to public health, such as vaccinations and access to public health, and how much goes to programs for the economic recovery. I expect that the programming will be similar to what we saw before, but certainly the council will have the opportunity to provide more detail, and that's what I would expect.
From Channel 4, how long do you anticipate it will take to get all the educators who want one a vaccine?
So the question is, how long will it take to get educators and school personnel vaccinated moving forward, since as of today they are eligible by state guidelines. That depends entirely on the supply of vaccine. There are many people in the community providing vaccines now. Some of our pharmacies are starting vaccination programs. Certainly the St. Louis County Department of Public Health will continue to vaccinate, and our health systems will continue to vaccinate. As we get more vaccinators and more vaccine, we'll be able to do this more quickly. But at this point, it'd be very difficult to predict a timeline for teachers and other educators. We still have a backlog of people in the previous categories who have not been vaccinated, and we still have a very limited supply of vaccine in our community.
Is the County Health Department working to offer vaccination clinics for other industries similar to the events that are being planned for teachers? Example, grocery store workers, utility workers.
So the question is about other groups who are eligible in Tier 3 in addition to educators. President Biden has given us the directive to prioritize educators and daycare workers in the new group that opened today, and that's what we'll be doing. But there are many other essential workers, essential to the operations of our community, who are now eligible for a vaccine, and we'll be working with all of those industries to help them understand the timeline and to get them vaccinated as well. But of the new tier that's opening, we will follow the direction of the president, and we'll focus first on school personnel and daycare workers. And again, recognizing that we have many, many individuals in the previous tiers, those with chronic medical problems, those over 65, who have not yet been vaccinated.
What do you know about a possible mega vaccination event in the St. Louis region? Are there sites in St. Louis County that are under consideration?
So the question is about a mega vaccination event in St. Louis County. We will continue first and foremost to get as many vaccination locations and as many vaccinators vaccinating individuals every day with as much vaccine as possible. And we believe that steady, daily, continual vaccination events at as many locations as possible is the best way to vaccinate our community. If we can add a mega vaccination event on top of that, that would be great. We'll certainly be in close contact with the governor's office to see what the vaccine supply looks like in the State Department of Health, and when we'll have more access. But a mega vaccination event would again depend on a dramatic increase in the supply of vaccine, and we still think we're a few weeks away from that.
That leads into the next question. Are you satisfied with the supply of vaccine that St. Louis County is getting from the state now?
So the question is whether or not we're satisfied with the supply of vaccine. I would say that I don't know that too many people in St. Louis County are satisfied with, or the St. Louis region for that matter, satisfied with the supply of vaccine. We need more. We have an enormous backlog of eligible individuals in St. Louis County. We have a commitment from the State Department of Health to increase our supply of vaccine moving forward. St. Louis County has been receiving more vaccine over the past couple of weeks, as have other vaccinators. But what remains is an enormous backlog of eligible individuals in the St. Louis region who need to be vaccinated, and we need much more vaccine to move through that backlog in an efficient manner.
Our final question this morning, what does it mean for St. Louis County that the city of St. Louis is getting more than $500 million as a stimulus command center?
So the question is about the meaning or the impact of $500 million or something near that number for the city of St. Louis as part of the stimulus relief. I know St. Louis City has a lot of needs, and that money will be used and will be put to work to help the people in St. Louis City. We want St. Louis City to be successful. We coordinate and will continue to coordinate many programs with St. Louis County and St. Louis City, as we have since the beginning of this pandemic. A lot of our humanitarian relief has been coordinated. Our public health response has been very tightly coordinated, not just between St. Louis County and St. Louis City, but in the region as a whole. And anytime St. Louis City has funds and has the opportunity to be successful, I think that's good for everyone in the region. And St. Louis County will continue to work with them very closely moving forward.